What is guaifenesin and codeine? Guaifenesin and codeine cough syrup is a commonly prescribed medication to treat cough that combines the opioid painkiller codeine with the expectorant guaifenesin. What is codeine? Codeine is a prescription opiate drug that's used to treat mild to moderate pain, cough and sometimes diarrhea. It's often used in combination with other substances, like paracetamol, to be more effective, and it's considered a controlled substance in the U.S. When someone takes codeine, it converts to morphine in their brain and then it binds to opioid receptors. This suppresses pain as well as the activity of the central nervous system. Codeine can be abused to get high because it can trigger feelings of euphoria as it binds to opioid receptors, but the effects are often less than other prescription opioids. There is also the risk for addiction and dependence, which is also lower compared to other opioids. Some of the common side effects of codeine include constipation, nausea and vomiting, drowsiness, dizziness, dry mouth, headaches. While codeine may be less potent than other opioids, codeine overdose is possible and can be deadly. What is guaifenesin? Guaifenesin is classified as an expectorant, meaning it can loosen congestion in the throat and chest. It's given to people to reduce congestion in their chest resulting from allergies, infections or colds. Some of the side effects of guaifenesin on its own can include headache, dizziness, rash, nausea, vomiting or general stomach discomfort. Guaifenesin with codeine. A doctor would prescribe codeine with guaifenesin to treat colds, allergies, or the flu in some cases. It's not intended to treat a cough resulting from smoking or asthma. Some of the most common side effects of codeine with guaifenesin include constipation and drowsiness. People are also warned against taking codeine with guaifenesin with other prescription narcotics or alcohol because it could lead to an opioid overdose. This often involves slowed or shallow breathing, which can lead to coma and death. Guaifenesin and codeine cough syrup. Guaifenesin-codeine cough syrup comes in many brand names, including Cheracol, Cheritussin and Robitussin AC. Codeine guaifenesin cough syrup is taken by mouth every 4 to 6 hours, and people are encouraged to drink plenty of water when taking it to deal with constipation or nausea side effects. This medication is a short-term treatment. People who take codeine guaifenesin cough syrup over the long term may experience withdrawal symptoms if they stop taking it suddenly. It is possible to become addicted to codeine guaifenesin cough syrup, and people who are at a higher risk for a substance use disorder should let their doctor know before taking any medication with an opioid. Guaifenesin codeine 10 to 100. There are different doses available for codeine guaifenesin combinations, and one of the most commonly prescribed is codeine guaifenesin 10 to 100. The 10 refers to 10 mg of codeine and 100 mg of guaifenesin. This is an oral, liquid version of the drug. Taking codeine with guaifenesin. It's important to tell your doctor or pharmacist of any and all other substances you're taking before taking codeine guaifenesin. Taking codeine guaifenesin with other medications that affect the central nervous system or slow respiration can lead to severe side effects and a potentially fatal overdose. If you or your loved one is misusing codeine guaifenesin despite negative consequences, help is available. Codeine and guaifenesin side effects. Get emergency medical help if you have signs of an allergic reaction, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Like other narcotic medications, codeine can slow your breathing. Death may occur if breathing becomes too weak. A person caring for you should seek emergency medical attention if you have slow breathing with long pauses, blue-colored lips, or if you are hard to wake up. This medicine may cause serious side effects. Stop using this medicine and call your doctor at once if you have noisy breathing, sighing, shallow breathing, a slow heart rate or weak pulse, severe dizziness or drowsiness, confusion, hallucinations, unusual thoughts or behavior, little or no urinating, severe constipation, or slow heart rate, weak or shallow breathing. Serious side effects may be more likely in older adults and those who are overweight, malnourished, or debilitated. Common side effects of codeine and guaifenesin may include constipation, or mild drowsiness. Warnings: codeine can slow or stop your breathing, and may be habit-forming. Misuse of codeine and guaifenesin can cause addiction, overdose, or death, especially in a child or other person using the medicine without a prescription. Do not give this medicine to anyone under 18. Before taking this medicine, you should not take this medicine if you are allergic to codeine or guaifenesin. In some people, codeine breaks down rapidly in the liver and reaches higher than normal levels in the body. This can cause dangerously slow breathing and may cause death, especially in a child. To make sure codeine and guaifenesin is safe for you, tell your doctor if you have ever had a cough with mucus, asthma, COPD, or other breathing disorder, blockage in your digestive tract, stomach or intestines, a head injury or brain tumor, low blood pressure, or drug or alcohol addiction. If you use codeine while you are pregnant, your baby could become dependent on the drug. This can cause life-threatening withdrawal symptoms in the baby after it is born. Babies born dependent on habit-forming medicine may need medical treatment for several weeks. Tell your doctor if you are pregnant or plan to become pregnant. Do not breastfeed. Codeine can pass into breast milk and may cause drowsiness, breathing problems, or death in a nursing baby. Do not breastfeed. How should I take codeine and guaifenesin? Follow all directions on your prescription label. Codeine can slow or stop your breathing. Never use codeine and guaifenesin in larger amounts, or for longer than prescribed. Cough or cold medicine is usually taken only for a short time until your symptoms clear up. Codeine may be habit-forming, even at regular doses. Never share codeine and guaifenesin with another person, especially someone with a history of drug abuse or addiction. Misuse of narcotic medicine can cause addiction, overdose, or death, especially in a child or other person using the medicine without a prescription. Selling or giving away codeine is against the law. Measure liquid medicine with the dosing syringe provided, or with a special dose measuring spoon or medicine cup. If you do not have a dose measuring device, ask your pharmacist for one. Call your doctor if your symptoms do not improve after 7 days of treatment, or if you have a fever with a headache or skin rash. Store at room temperature away from moisture and heat. Do not freeze. Keep track of the amount of medicine used from each new bottle. Codeine is a drug of abuse and you should be aware if anyone is using your medicine improperly or without a prescription. Codeine and guaifenesin dosing information. Usual adult dose for cough. 1 dose orally every 4 to 6 hours as needed. Codeine, single dose, up to 20 mg, maximum dose, 120 mg in 24 hours. Guaifenesin, single dose, up to 400 mg, maximum dose, 2,400 mg in 24 hours. Maximum dose should not exceed maximum dose of either of the single ingredient doses. Comments. Liquid preparations should be measured with an accurate milliliter measuring device. This combination drug should not be used in patients with chronic pulmonary disease or shortness of breath unless directed by a healthcare professional. Uses: temporary relief of coughs due to minor throat and bronchial irritations as may occur with the common cold or inhaled irritants, helps loosen phlegm and thin bronchial secretions to make cough more productive. What happens if I miss a dose? Since codeine and guaifenesin is used when needed, you may not be on a dosing schedule. If you are on a schedule, use the missed dose as soon as you remember. Skip the missed dose if it is almost time for your next scheduled dose. Do not use extra medicine to make up the missed dose. What happens if I overdose? Seek emergency medical attention. A codeine overdose can be fatal, especially in a child or other person using the medicine without a prescription. Overdose symptoms may include slow breathing and heart rate, severe drowsiness, muscle weakness, cold and clammy skin, pinpoint pupils, and fainting. What should I avoid while taking codeine and guaifenesin? Codeine and guaifenesin may impair your thinking or reactions. Avoid driving or operating machinery until you know how this medicine will affect you. Dizziness or severe drowsiness can cause falls or other accidents. Do not drink alcohol. Dangerous side effects or death could occur. Ask a doctor or pharmacist before using any other cough or cold medicine. Many combination medicines contain guaifenesin. Taking certain products together can cause you to get too much of this medicine. What other drugs will affect codeine and guaifenesin? Taking codeine and guaifenesin with other drugs that make you sleepy or slow your breathing can cause dangerous side effects or death. Ask your doctor before taking a sleeping pill, narcotic pain medicine, prescription cough medicine, a muscle relaxer, or medicine for anxiety, depression, or seizures. Other drugs may interact with codeine and guaifenesin, including prescription and over-the-counter medicines, vitamins, and herbal products. Tell your doctor about all your current medicines and any medicine you start or stop using.